Code Pink Missing Person or Abduction Response Protocol and Policy. Purpose: to establish guidelines relative to the safety and security of patients and visitors. Policy: all staff shall take appropriate measures to locate a missing infant, child, or adult patient or visitor who is reported missing. Specific information: the first few minutes after a person is missing or abducted are critical. Quick, decisive action may help locate the missing person or prevent an abductor from leaving the premises. Missing person situations. Internal disaster: the person is missing and presumed injured, killed, or displaced as the result of an internal disaster event, example, fire, building collapse, hazardous materials incident, etc. Disability: situations which will endanger the person or public if the person is not located, for example, persons requiring medication or medical treatment to survive, Alzheimer's patients, psychiatric patients, head injury patients, etc. Endangered: the person is missing and presumed endangered, example, extreme weather conditions, emotional crisis, etc. Involuntary: the person is missing and presumed endangered as the victim of a crime, example, kidnapping or abduction or custodial interference situation. Adolescent: the missing person minor, under the age of 18, and the incident is not attributable to any reason listed above, they are presumed to have run away voluntarily. Missing person: a person whose whereabouts are unknown and safety and welfare cannot be determined, as defined by one or more of the situations described. Additional note on missing person. Physical description of missing person to be noted: race, age, gender, height, build, slender, medium, heavy, hair color and cut, clothing description, and any medical devices attached to the individual at the time the person is reported missing. Patient-specific definitions. Llama or leaving against medical advice: a patient goes llama when he or she insists on being discharged or leaves the healthcare facility despite recommendations of medical personnel that the patient should stay for treatment, and even though the patient is told he or she is in danger of adverse medical effects by being discharged. Mentally competent: a patient is mentally competent to make his or her own health care decisions when he or she understands his or her situation, understands the risks associated with the decision to leave without recommended treatment, and can communicate a decision based upon that understanding. Adult: person aged 18 or older. Special considerations: by law, an adult has the right to privacy, freedom of movement, and association, and any attempts to locate the missing person must be made with caution so as to not violate those rights. However, this should not limit any attempt to locate a missing person. The following should be considered when attempting to locate a missing adult. Adult patients are normally being treated at the hospital on a voluntary basis, with their own consent, or with the consent of someone acting on their behalf. A mentally competent adult patient has an absolute right to refuse medical care for any reason, or for no reason, even when that decision may lead to his or her own death. A mentally competent adult patient cannot legally be prevented from leaving the facility, or forced to return to the facility after he or she leaves. Accordingly, mentally competent adult patients who leave the facility llama are allowed to leave. A missing person alert should be initiated. Patients who are not mentally competent, including those with psychiatric disorders that make the patient a danger to themselves or to others, may be detained inside the healthcare facility against their will or returned to the healthcare facility against their wishes. When a patient who is not mentally competent goes llama or cannot be located within his or her assigned care or treatment area, an alert shall be initiated immediately. Adolescent: a person aged 13 to 17 years of age. Special considerations: An adolescent may be missing under a variety of circumstances, as a patient or a visitor. Examples of a missing adolescent can fall into these categories. An adolescent leaves without permission and is considered a runaway who has eloped from the hospital. An adolescent is abducted by either a stranger. Child, aged 1 to 12 years of age. Missing child. Special considerations. A child may be missing under a variety of circumstances, as a patient or a visitor. Each of these circumstances is treated in the same manner. Examples of a missing child can fall into these categories. A child wanders away from a parent or caregiver. A child is abducted by either a stranger. A child runs away voluntarily. Infant, a child younger than 12 months old. Notification procedure. When a staff member suspects an infant is missing from the ward, the nurse will notify the security department and inform them that an infant is missing. If the infant is known to have been abducted, a description of the abductor shall be given if known. Will inform of the last known location of the infant and how long the infant has been missing. Notify the patient's attending physician if the infant is an inpatient. Inform staff members in the area and designate staff to inform families on the unit that a police investigation is underway, as the police presence on the unit will be evident and law enforcement officials may need to question them about what they may have seen. Assign a staff member to stay with and support the family members of the missing infant that are present. The family will be kept informed and updated on the search status through this staff member. The security department will notify the following: appropriate administrative person, MS or MD, who in turn will inform public relations. Security will notify additional law enforcement personnel or agencies, as appropriate. Search protocols for all missing persons incidents. Staff in areas that are located at, or around exits, access points of the medical center shall monitor those areas and report any possible sightings of the missing person immediately to security. For infants, staff reports any suspicious persons or activity they observe in those areas, specifically those involving newborns or persons carrying items large enough to conceal an infant. Security will assign officers to the unit that reported the missing person and to search the exit pathways from the facility, to include adjacent streets and parking areas around. On-duty staff members assigned to the unit or area where the person is reported missing, will report to their unit or area for further instructions. All clinical staff in the hospital will search their respective units and all adjacent common areas for the missing person. Support and administrative staff not assigned to the incident will search common areas of the medical center to include hallways, corridors, garage connectors, cafeterias and break areas, basement and sub-basement connectors. Security will designate appropriate personnel to review the digital camera systems that cover the egress areas from the unit and the medical center. If the missing person is not located during an initial search, may inform police. Incident protocols, by missing person definition. If the area or unit is not locked down or does not have the ability to lock down, the area will be secured by unit staff being dispersed to the entrances and exits, and access to the area will be restricted. The manager will assign staff to stand outside the area to permit and document only authorized on-duty personnel to enter. The area should remain locked, or exits staffed until it has been determined that the infant is located and in the area and no abduction has occurred, or a security officer has informed the nurse or manager that it is acceptable to unlock and remove staff from the exits. Staff, visitors, and families will be questioned about the incident by security and/or other law enforcement personnel only. The physical environment in the immediate vicinity of the incident will be left untouched and secured for law enforcement personnel. The infant's family members that are on the unit at the time of the incident will be moved into an empty patient room or other private, unoccupied space on that unit. All of the patient's belongings will be left in the patient's room. The nurse or manager or their designee will secure the infant's medical records and initiate appropriate measures to obtain the cord blood sample and the security photo of the missing infant, if available. All staff on duty in the unit when abduction occurs, even if this occurs during change of shift, will remain on the unit until law enforcement personnel releases the staff members. If the person is recovered in a timely manner inside the hospital, he or she will be taken to the emergency room and examined by a physician while the family of the infant is notified.